Good morning, Martin. My name is Lucy Gibney. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you say your full name for the record, please?
My full name is Martin Dale.
And what is your candidate number, please?
My candidate number is 251072108.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What do you do when you don't know the answer to something at work? Whether it's how to address a situation or answer a patient question. How do you go about getting more information?
When I don't understand something at work, I seek out help. I don't let my pride get in the way of quality patient care. I generally ask someone who has more experience than me to help out and do it in a timely manner.
Can you explain situations without using a lot of medical jargon?
I have various patients with different educational backgrounds and ages. So I must break medical jargon down into understandable ways. For example, whenever a doctor orders radiology for a patient, I make sure that I explain to the patient they are getting an X-ray. Also, I try to make sure the patient understands by asking them to repeat what they think they heard. That way, everybody is on the same page.
How you handled a family or patient who was displeased with your care?
I strive to provide high-quality care to each patient. However, sometimes the patient doesn't agree with my methods. For example, I once had a patient who complained about how I administered his insulin. He told my administrator that I stuck the needle in too quickly and not gentle enough. From that point, I decided to go especially slow with that patient to accommodate their needs and provide patient-centered care.
Describe a situation where you were under a lot of pressure.
I experienced pressure every day as an ICU nurse. On one occasion, I had to cover more patients than usual because of a coworker calling out sick. I decided to create a list and prioritize care. By organizing and paying attention to detail, I was able to manage my increased workload successfully. After work, I often practice yoga, so that I don't take any of the stress with me.
Describe a problematic patient you have had in the past.
Trying to get children to take their meds is challenging. I had one kid who cried and threw a fit every time we wanted to give them medication. So, one day I asked the kid a simple question, "What's your favorite kind of ice cream?" The child said chocolate, and I brought them chocolate pudding to take with their medication. It did the trick. The child stopped screaming and crying at medication time, and I earned a friend on the floor.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Your preparation time is over. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please?
Hi, good morning. My name is Martin Dale, one of the registered nurses working in the hospital.
Hi, good morning.
Can you say your full name for the verification, please?
My full name is Lucy Gibney.
Hi, Lucy. As per the doctor's report, you are having the excision of a pilonidal sinus next week. Is that correct?
Yes, correct.
All right. I'm assigned to discuss your treatment and also to do some preoperative documentation.
Okay.
You seem to be confused. Do you have any sort of concerns about your condition?
Nurse, I'm having more pain than usual.
Oh, I am sorry to hear that. Haven't you taken pain medications?
Nurse, I feel as though I am very weak because I am taking painkillers for this ailment more often than usual.
Lucy, your concern is quite natural. I understand your emotional state. I think don't bother too much. Painkillers are to be consumed for pain relief. Consider it only as medication and follow the doctor's instructions to consume it.
Okay, nurse, I will follow your instructions.
Great, thank you for listening to me. Well, do you have any other problems to be discussed?
Yes, nurse. But I am so embarrassed to talk about this ailment. I have even quit all my social interactions because of this.
I totally understand your embarrassment. But Lucy, doctors and nurses are used to a huge range of medical issues. So, it is not a matter to be embarrassed. We understand each patient and please don't feel so to talk with us.
Okay. Well, nurse. When the doctor explained to me about the pilonidal sinus, I couldn't pay attention. Could you please explain it to me, nurse?
No worries, Lucy. I'm glad to explain it to you. A pilonidal sinus, PNS, is a small hole, or tunnel, in the skin. It may fill with fluid or pus, causing the formation of a cyst or abscess. This small opening or tract on the surface of the skin is predominantly caused by ingrown hair, exacerbated by sweat, and prolonged sitting. That means, it usually contains hair, dirt, and debris, and can cause severe pain, and can often become infected.
Nurse, I am very clean, and care for my body very consciously. You know, due to my work I shower twice, in the morning and have a bath at night.
Oh no. Lucy, I didn't mean that anyhow. Please, don't misunderstand my words. My intention was to just explain what the pilonidal sinus is, and how it is affected. I didn't mean that you are not tidy.
All right. I got it. Well, if you don't mind, could you please explain to me what I need to do after the procedure?
Yes, I am glad to brief you about it. Avoid sitting for a long time, or sitting on hard surfaces until your incision has healed. You can shower as usual. Rest when you feel tired. Try to walk each day. Lucy, I reassure you that I am not indicating you are dirty. But taking salt baths post-operatively will help facilitate healing.
Yes, I understand you, nurse.
Good to hear that. And about the post-operative care, kindly note for any signs of infection or bleeding. You should have to be given proper attention to it. In case if you notice any abnormal pain or discharge, without any further delays, inform the doctor or the hospital, and take consultation as needed. There is nothing to be embarrassed about. You should take analgesia appropriately. Also, the use of antiseptic dressings will help to heal the wound quickly. Follow the instructions and medications properly.
Sure, I assure you that I will follow the doctor and nursing staff's advice. Also, I will adhere to the medication regime, rather than suffer pain.
That sounds awesome, Lucy. Do not hesitate to contact us in case of any inquiry.
Sure.
Is there anything else to be clarified by me?
Not really.
Great. Then see you next week for the procedures.
Sure, thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.